let's move along with, let's look at the drawing of Lingudabai. So, you know, this isn't very different than the photo. What you're seeing is Lingu, 2205 Lingu, is placed right at the intersections of the two bones, as close as you can get to that intersection without getting stuck between the bones, right? You want to slide down the intersection. This one is Hagu, large intestine 4, is right in the middle. This is 2204 or Dabai, headed underneath the second metacarpal bone towards the palm. Okay, it's not perpendicular unless you're talking about perpendicular to the skin, which it kind of is when it's done properly. All right, we're going to watch a movie, so we'll just talk a little bit more about these. Pathway is large intestine, reaction area is lung. Okay, that's interesting, right? We have lung, large intestine, okay, metal element, but we also have hand tai yin with foot tai yang. So we have the connection here, the operative connection of UB channel, lung UB. So we have large intestine, we have lung, large intestine, we have lung UB, forbidden to needle in pregnancy. So I'm going to bring that out here. If there's any kind of caution whatsoever, you can trust not just my books, every book on Dong's points will have a caution if there is one. So you can trust that. If it's silent to pregnancy, it's okay. You can use it in pregnancy. When it says forbidden to use in pregnancy, don't do it. All right, let's look at your indications here. Lower back pain and sciatica are #1 indications for Lingu and Dabai. But common cold, headache, high fever, hemiplegia are also right up there. So Lingu and Dabai are almost always used together. Dabai is actually a chief point. Okay, Lingu in the combination of Lingu and Dabai, sorry, that's my clock. Lingu is the chief point, Dabai is the supporting point. But Dabai is also a chief point all by itself. So they are both incredibly powerful points, especially when used together. The combination of Lingu and Dabai tonifies the qi and warms the yang, among other things. Okay, so here's spirit bone or Lingu, large intestine lung again, forbidden to needle in pregnancy, because the combination of Lingu and Dabai are acting as Dong's large intestine 4. This is Dong's version of large intestine 4 is Lingu and Dabai, forbidden to be used in pregnancy. We have a few more indications now because Lingu is a little more powerful, but both Lingu and Dabai get their power from Hagu, large intestine 4. All right, let's look at these. Back pain, spine pain, sciatica, hemiplegia. We've talked about all of those. But now we get into the head and the wind issues, okay? Large intestine, wind, headache, dizziness, tinnitus, migraine, facial paralysis, all wind, right? And then we get into joint pain, shoulder pain, tennis elbow. All right, now we have our Yang Ming connection, weak digestion, abdominal pain, anal prolapse. Now we have our lung UB, so large intestine lung, reaction area of the lung, large intestine channel. Now we get into our UB, okay, interstitial cystitis, fatigue, muscle atrophy. Why? Because we have large muscle here. This is in the huge muscle. This is opposite the thenar eminence, okay? One of the largest muscles in the body for its size. You know, it's like a super powerful, strong muscle. It's like a masseter muscle, very strong muscle. Buttocks, gastroc, those are very strong muscles. Big blood supply, big nerve supply. So we see muscle atrophy. We see groin pain, leg pain, heel pain, okay? Opposite side leg, menstrual difficulties, and labor induction. Why? Because Hagu, colon 4, is forbidden to be used during pregnancy. That means it's a really good point for inducing labor. So we use it. Let's keep going. Probably a lot of this I've already said. So Hagu, colon 4, large intestine 4. Miriam used to say colon 11, colon 4. So I got it in my body over large intestine. I have to kind of correct myself to say large intestine because most of you probably use that. So the large intestine 4 is a major yuan source point. So that's where Lingu and Dabai are getting their power. They nourish and warm the yang, tonify qi. Okay. Muscle atrophy. Yang Ming channel has more qi and more blood. Very useful in muscle atrophy. Because of the connection between hand yang ming and foot shui yin, we also have symptoms, wind symptoms, dizziness, tinnitus, groin pain. Why? Because liver channel goes straight through the groin. Not as good as heart gate, all right? But we can use it. We can use it. Knee pain, shoulder pain, urinary disorders. Okay, Lingudabai. So we have to do active qi moving technique. Otherwise, how is it going to know which direction to go? We want to move the affected area if we're using it to treat a structural problem. Okay, let's watch a movie here. Lingu and Dabai are paired, but Lingu is your chief point, Dabai is your auxiliary point. So we always need a Lingu first. We find Lingu by walking down where the first and the second metacarpals come together. We find that junction and come as close to the bone as we can without really hitting it. We want to slide right down inside the junction. So push with your guide so you can really see where you are. Take that down.